So that person receiving care could be ill, disabled, frail, or misuse drugs or alcohol. So we've got lots of different projects within Carers in Hertfordshire that cover a wide variety of caring situations. I am actually an involvement and development worker who works with the 0 to 25, not the 0 to 25 team, because we are independent from Hertfordshire County Council, but I work with parents and young people of children with disabilities. The difference between our charity, perhaps, and some of the wonderful information that's out there today is that we're here to support you as a family carer or anyone that you are caring for. And interestingly today, although I work with parents of children 0 to 25, I've spoken to quite a few parents and different people today who are maybe looking after elderly parents or their husband or wife or things like that also, as well as parent carers. So we're a charity that covers all caring situations and all ages. So as I say, although this event today is particularly for parents and children with the local offer of 0 to 25, you may find yourself that you might be caring for more than one person. That's what I just wanted to cover. So what do we know about carers? I mean, I'm not sure how much you're interested in facts and figures, but I can just give you a brief outline if you like. There are 7 million carers in the UK and around 800,000 young carers. And 3 in 5 people will be carers at some stage in their lives in the UK. And 40% of carers are men, which is quite an interesting figure because we don't tend to. The typical scenario of carer is perhaps a woman, which is not the case anymore really. A lot of husbands are caring for wives or caring for parents. So we try to cater for that as well in our activities. And 1 in 7 carers juggle work and caring. So it's quite a big, quite a lot to think about. So we also find that in our work, we're told that 3 in 5 carers have given up work or reduced their hours to care. 39% of carers are struggling financially, and 83% of carers says that caring has a negative impact on their physical health and 87% on their mental health. 39% of carers have put off medical treatment because of caring. So they're just some facts and figures to give you the idea that of what caring, what is important to them. Have significantly lower attainment at GCSE level, and young carers are more likely than the national average to be not in education, employment or training, it's called NEET, between the ages of 16 and 19. And around 1 in 20 misses school because of their caring responsibilities. And young carers are 1.5 times more likely than their peers to have special educational needs or a disability. So what do we do at Carers in Hertfordshire? We offer free support for carers to support them to continue caring if they want to. We want to make caring visible so that carers are identified and supported earlier in their caring life, which is why we're particularly interested in starting at the parent-carer end. Carers to feel confident and in control and to be recognised and appreciated for the contributions they make. And carers to have a stronger voice in the system. So one of our aims is to speak up for carers at whatever opportunity we have. So what do we actually do? Well, one of our main things that's very interesting for carers is a discount card, and I don't know if any of you have the discount card. Yes, so this is something that we have a whole booklet of discounts. It's also, all the discounts are online, but this is a good way to get registered with us and also get some benefit for yourself. It is a sort of reward for your caring opportunities, and we negotiate with various businesses and around in all of Hertfordshire, and they're done out in the book in different areas. So you'll see some of them are as varied as, there are discounts in chemists and discounts in various different restaurants and things like that. It's a bit similar to the hand card that Hertfordshire have, but this is more focusing on you and benefits from you as a carer. So please do have a look and take a form. We'd really love you to be involved. We also have local hubs, which are for any carer that wants to go along, and they're all over Hertfordshire, and there's a list in our care waves. Again, I can give them to you if you want to. They're not specifically for parents, they're for anybody that's a carer that wants to come along, and we have speakers and things like that. It's a form of reducing isolation and also encouraging people to meet other carers. And we also have a mentoring scheme, which again, you might be interested in. A mentor is someone who has been trained by carers in Hertfordshire, who is already a carer, and they have done specific training to train them how to mentor somebody else. So the idea is that they would mentor you in your, not in your caring role to improve your way of caring, just to mentor you to look after yourself, help you with an issue that maybe is difficult for you. You would meet this person for a coffee. It goes on for about 6 months, and then, you know, if you need to extend it. So again, that's something you might be interested in. We have a fact sheet on it, if that's something that would be relevant to you. If there was anything specific you felt would be useful, we're always willing to listen, and then we could, you know, expand it to other people. We also talk about having a say, and we're very keen to promote carers having a voice in services and things like that. And we have a good working relationship with the health service and with HCC about speaking up about services, and they often come and ask carers to give their views, and we facilitate that. And the Young Carers Service, again, I don't know if any of you are interested particularly, but it's the whole we do the whole family support through home visits, and give support to access other services such as mentoring groups and counselling. And we support young carers between 16 and 18 when they're transitioning to 18 through a transition assessment. Again, I've got information on the Young Carers Service. Again, with young carers, they have opportunities to meet other young carers, residential trips, and we're doing a skiing course at the moment. They have a young carers conference, and as a council and the youth executive, and young carers in the school ambassador programme. We work with schools trying to raise the profile of young carers. We also have bereavement volunteers when caring ends, which may not be in this particular group, but it does obviously happen, and therefore we've got a group of volunteers who will work with you, and your caring, you don't end up not being involved with Carers in Heart just because that happens. We continue the support for 3 years. And that really is a snapshot of everything that we cover.